Hey everybody, Stephen Fogg with Fogg Healthcare Marketing. I'm going to just give you a State of the Union, I guess, an address of how the healthcare landscape in the marketing sense is looking today. Well, recapping things to now is, we're on phase 3 of this journey per se. First phase was how to market your practice during the pandemic. So many of you were addressing what you're doing to combat COVID-19. What things do you guys have in place to do so, and how does it make an impact? The second phase was your reaction to the cause. Probably 99% of you implemented telehealth, which is great ideas. And other things that your reaction to. How are you screening patients that are still coming into your practice? What are you doing? Social distancing, whatever it might be. Phase 3 is what we're in right now, is the messaging for the new norm. So right now, acquisition marketing, mostly off the table for many of you, unless you're an ER practice. But again, you have such a demand that the need isn't there right now. So it's really educational, be staying in front of you and adding value how you possibly can. What does that look like? Well, many of you started with the telehealth, but we're seeing others leading on with other things you can do in the virtual space. Q&A Facebook sessions with the provider has been a great one. Offering classes, maybe tag teaming, with a local gym that's offering telehealth and providing it through your patients through your portal. Boosting subscribership to a newsletter by implementing new recipes or things that they can stay home to, that recipes that people can use and they stay home to help ease their pain of dullness of cooking the same thing over and over again. These are just a few of the ideas that we're seeing out in that space. So that's where we're at right now. We're in the new normal of marketing during the pandemic. What are we starting to project next? I think that's what many of you are wondering as well too. Well, we are trying to figure out what is the messaging when all is said and done. When we can turn the lights, when we turn the lights back on, you start getting life back to normal. What does that message look like? Now, for many of you, you're gonna try to jump right back into where everything began, and that's a good, decent spot to start at. But I would strongly encourage you to look at some of your numbers, some of your data during this whole period, and see what has changed. Who have you guys cultivated a different, I don't know, patient or group or whatever it might be into your practice, and try to bring that information into your messaging moving forward. I think many of you probably are going to be offering telehealth on a full-time basis now, which might be allowing a lower cost option for your patient. It might be in a more convenient space for your providers to serve more patients. And I think that's a very good idea. It has a lot of value in the practice in the world today and moving forward. But truth be told, we are still trying to understand what it looks like too. So, we're pulling up old case studies from 2008, from 9/11, and even going further from the recessions of 87 and the gas crisis in the 70s, of what is the messaging looking like after everything's said and done. And it's still up there. So I'm curious on your side, maybe if you're a marketer watching this video or if you're a healthcare provider, what are you thinking the messaging is going to be when we get done with this? I don't think it's going to be all happy-go-lucky back to normal when this is all said and done. I think there's going to be still a phase in between, a mad rush, you would say, to kind of get in front of other people. So I'm encourage you, give me some feedback in the comments section of this. And if you have any questions, comments, or concern, please, as always, don't hesitate to reach out to me directly. And with everything, I want to still thank the beautifully smart men and women on the front lines fighting this fight for us. So all of our physicians, our nurse, our healthcare staff, everybody who is there, we are praying for you daily. And thank you for your service you're doing to this. And there is an actual great nonprofit out there called CLT Gives PPE. I encourage you to find that on Instagram or Facebook and give to their cause, because they're a group of providers who are cultivating PPE materials for people on the front lines. So that's it for me. Again, Stephen Fogg with Fogg Healthcare Marketing, and I hope you have a successful day and week ahead. Thanks. Bye-bye.